Hi, good afternoon and welcome out there in Facebook world. Today is April 22nd. My name is Chris McCoy. I'm here and joined with Dr. Bunyo again. Once again, we're going to talk about some COVID-19 updates, and we've taken some more questions from the public, and we're ready to go over those now and kind of get some answers out.
Great.
How have you been?
I'm good. Thank you, Chris. Thanks for having me.
Did you notice my new mask?
Yeah, I like it.
All right.
I like it a lot.
Christy made us some masks for the team, and I'm getting to wear it, and it's not as bad as I thought it would be, so I wanted to report that out there. If anybody hadn't grabbed a mask yet, there's a lot of folks out there selling them. There's probably some folks out there with extra materials that would just make you one if you wanted one, so
yeah,
make sure you grab a mask and put it on. What's the status been? How are things going?
Things are going well. Testing is really going well. We are... So far, I've talked to a lot of other medical officers in Western North Carolina, and it's like we're all dressed up and nowhere to go just yet. You know, we're prepared. So
it's a good thing, right? I mean, It's a hurry up and wait kind of process, but we're there and we're prepared and ready for any kind of influx of this we see.
I think we're in good shape out here.
Good. Some updates now on the last time. I don't know if it's a question we're going to have here, but last time we talked about the swabbing. Do we want to clarify that a little bit about how the swabbing process is going on and what some of the differences and nuances are?
Yeah, absolutely. So I know last time we talked about, are we swabbing one nostril or two? And there's been some changes. So we were swabbing both nostrils and going all the way straight back into what we call the nasopharynx. So now it's recommended that if you're going to do that test where you go all the way back, you only have to do the one nostril, not both. But there are some newer tests coming out. They're not quite ready yet. But if we're only going to go back about an inch or so, that has to go to both nostrils. So it kind of depends on which test you're doing.
Gotcha.
But for now, I think we're probably in the screening, if we haven't already done it as of today, we're just going to go down to one nostril and not both.
Excellent. That's a good update for everybody to understand. Good. Okay, well, let's get in. So we've got the COVID-19 informational hotline here. 828-497-3743. At any time today, you can call that number. At any time, I guess, regularly.
Yep.
Call that number if you have any questions. Can you see me there? Just make sure we get it up and live. All right. So, are you ready to begin?
I'm ready.
All right. So here we go. These are hard hitting, I heard.
Yeah.
So thank you to the public for reaching out to us and giving us these questions. And again, we're gonna do this every Wednesday until we need to until we answer all the questions or until we resolve this. But please post on the Facebook any of your questions that you have follow-ups with, and we'll certainly get them on here if we can. So if I was exposed to COVID-19 today and tested tomorrow, would the test be positive?
Probably not.
Okay.
So if you were exposed today, it's going to take somewhere between 2 and 14 days for you to show symptoms. And on average, it's going to take about 5 days. So if you were exposed today, we would recommend that you take all those precautions to protect your family and those around you, but maybe consider getting a test. Number one, if you start showing symptoms, which is fever, cough, shortness of breath, or if it's been about 5 days since your exposure.
Now, you don't have to have all of those symptoms, right? If you start to have any of those, that's something to take precaution with, right?
Correct. And we also know that up from about 20 to 25% of the people that get COVID don't show any symptoms at all.
Okay.
So if you are really nervous and you think you've been in close contact with someone that has the disease, I'd say wait about 5 days, come up to the drive-thru, we'll run the test for you.
Great. So now, if I go to Walmart and am exposed to someone who is COVID positive, or I handle products at the store that may have surface contamination, does that contaminate me and my clothing?
Well, there's a possibility. So we know that there are a couple of different ways that this virus gets transmitted, and one is contact. So that means somebody with it, they touch their nose or mouth, they touch something, and then you come by later and touch it, and then you touch your eyes, nose, or mouth. It's not going to go through your hand.
Okay.
It's got to get to somewhere on your face. That's why we say don't touch your face.
Gotcha.
We know that on cardboard, the virus seems to be able to live somewhere between 12 and 24 hours.
Okay.
And on plastic and stainless steel, up to 3 days.
Oh, wow.
So my advice is if you're buying stuff that's not perishable, you can just put it away for 3 days, or you can wipe it down. Most important thing, wash your hands frequently.
After you've handled anything.
Yeah.
We're still treating it as if it's on every surface at this point.
That's the safest thing to do.
That's the safest thing to do. Excellent. What can I do to protect myself and my family?
Well, I think we've been pretty consistent with this, and it's all the same stuff. It's social distancing, staying at least 6 feet away from other people, wear masks when you're out and about, and wash your hands frequently.
Okay.
Yeah.
And that's the best things to do.
Yeah. Or hand sanitizer works okay as well.
Okay.
Oh, well, look at there.
Is hand sanitizer effective?
Yes, it is. It does have to, if it's got the alcohol in it, it has to be above 70%.
Okay.
So you want to make sure you check the labels on that. But yes, hand sanitizer is effective at killing the virus.
And something that I've personally been doing, and it may be overkill, but I don't feel like it is, I did have to make a run every once in a while to a store or to check a mailbox or something. And I'm making sure when I get back in my vehicle that I'm sanitizing my hands and I'm hitting the door handle, I'm hitting the steering wheel, hitting kind of everything I might have touched in those brief moments before I get on the road again. Is that something you would recommend?
Yeah, I do the same thing. I've got a little bottle of hand sanitizer that my wife made up because we couldn't find any.
Oh, yeah.
And as soon as I get in the car, I'm cleaning my hands, and then usually I have a little excess, so I wipe that on the steering wheel and the stick shift and the door handle.
Okay. I felt like I was overkilling it, but it sounds like it's kind of the thing. So is it safe to donate blood during the coronavirus pandemic?
Yes, it is.
Okay.
I mean, obviously, you don't want to do it when you're feeling sick, but it's perfectly safe to donate blood. And in fact, they need people to donate blood during this time.
Okay, that's good to know. So the virus itself isn't traveling in the blood, or
no?
Okay. So are antibiotics effective in the treatment of COVID-19?
No, they're not. So antibiotics are used to fight what we call bacterial infections. This is a virus. Antibiotics don't work. Your best defense is stay healthy, keep your immune system up, and we're looking at developing a vaccine. So when we get that, that should help prevent you from catching the virus.
So what will the vaccine, I guess it's kind of speculative at this time, the time frames are typically, I've heard 18 months to develop one, but we're kind of speed processing this, is that right?
Yeah, they're going as fast as they can. So the vaccine, typically what they'll do is they'll take the virus or some form of it and they'll kill it, or they'll make it so it can't harm you. They'll inject that into you, and your body will develop those antibodies we've been talking about.
Gotcha.
So if you catch the virus, your body will make antibodies, assuming you recover.
Right.
And the vaccine does the same thing.
Gotcha.
But it's a ways off. It's at least a year out.
So are there similar vaccines at this point? What are some other vaccines that we commonly have out there for us? Is it like the flu shot? Is it something?
Yeah, the flu shot's the classic one that you have to take every year because the virus changes. And that's the tricky thing about these, is you pretty much have to develop the vaccine every year for the flu, or the one from last year doesn't work.
Gotcha. Okay. But don't be at home taking antibiotics that you have in your medicine cabinet thinking that that's going to help you. That can only hurt you, I'm sure.
Not going to help you at all.
Okay. Can COVID-19 live on objects such as mail and packages? And I know we briefly touched on this earlier.
Yeah, we think the risk in mail and packages is very low. As I mentioned, it can only live for 12 to 24 hours on cardboard. So my advice, I think it's perfectly safe to get stuff in the mail. Just unwrap it, wash your hands. You should be good to go.
Gotcha. How does coronavirus spread?
So this is actually a really good question. We mentioned that it's spread by contact, so we already covered that. But it's also passed to other people through the air.
Okay.
And there are two different ways that it can be transmitted. One's called droplet, and that's why we're wearing these masks. So if I'm coughing or sneezing, and even when I'm talking, little micro droplets are going out into the air. If you breathe those in, you could catch it.
Okay.
So me wearing a mask protects you. You wearing a mask protects me. It's not 100%, but it's better than nothing. Some people think this virus may also be spread as an aerosol. So when you think about droplets, think about hairspray.
Okay.
Those are droplets. They go out and they'll fall to the ground. An aerosol is kind of like those, if you've ever seen little specks of dust in a shaft of light, that's what an aerosol is like. It's tinier, it stays in the air longer, travels further. So we're not 100% sure, but that's why we recommend at least staying 6 feet apart from other people.
Gotcha. Okay. Now, I had a follow-up question to that, and I've already forgotten it. So I'm sure I'll circle back around to that one.
Okay.
We were talking about it there. When will things get back to normal? Will summer heat kill the virus? That's two pretty broad questions there.
Yeah, so there's been a lot of talk about this, and I'm going to give you my opinion because first of all, nobody knows for sure.
Right.
But I don't. Usually, we see that viruses like this will decrease in the summer,
Okay.
but they don't go away. People still get colds in the summer. It's summer somewhere in the world all the time.
That's true.
And they are still having this problem down in South America and Australia. So I do not believe that the summer heat is going to get rid of this problem for us. We'll see a decrease, I think, but then I'm really concerned that in the fall it's going to pick back up again.
Okay.
When will things get back to normal? I don't know. I think we're in for changing the way we live for at least a year, maybe more.
Okay.
And some of that's not a bad thing. I mean, us washing our hands and protecting ourselves from viruses, that's the kind of stuff that we probably should have been doing all along.
Right. And so, yeah, the normal in and of itself may change or evolve a little bit as we come out of this.
Yeah, I think so.
What is the difference in the new coronavirus and other coronaviruses? Okay, so yeah, I've seen it on certain packaging. Lysol, for instance, has a coronavirus listed on it far before this was a thing. What is the difference in coronavirus?
Okay, so that's a good question. Coronaviruses have been around for a long time, and a lot of them just cause things like the common cold.
Right.
But this coronavirus, it's new. We've never seen it before, and it's in a part of this family of viruses that includes things that you may remember: SARS, MERS, and there's a number of these coronaviruses that seem to live in bats.
Gotcha.
So what's different? Well, this one seems to be very contagious. As you can tell, it's much more lethal, and it's just brand new. Our bodies have never seen it before.
Gotcha.
One of the things that we're finding is we think that people are probably spreading this virus for a couple of days before they even know they're sick. And that's why it's so hard to control, and why you and I are wearing masks even though we feel perfectly well.
Right. And so it's the incubation period we talked about before. It's long, much longer on this than, say, the flu. Isn't the flu like a day or two, and then you're seeing symptoms?
Yeah.
And this is up to 14 days or longer?
Yeah, it's a long incubation period, and it's the fact that you can transmit the virus long before you even know that you should be staying home. So that's why we're telling everybody to pretty much stay home until we get this thing under control.
We're such a social people. It's a tough battle we've got going on with that.
It is tough.
Okay, do you have to be enrolled to be tested at the drive-thru?
No, you don't. So at this point, with the controls that are in place, if you can get on the boundary, you can be tested.
Okay.
We want to protect this community. So anybody that's coming here to work,
Right.
or if they are a descendant, we want to know if the virus is out there.
Okay, good. And we're still urging, at this point, we're still looking at one person per
household.
Per household.
And yes, and so the reason for that is we want to spread the testing out to as wide an area as possible. And if anybody in one household tests positive, then we're going to drill in and we're going to go in and test
out where
everybody
that's
at that point.
Gotcha. Does alcohol kill the virus or make you more susceptible to it?
Okay, well, it depends what you do with the alcohol. So alcohol on surfaces kills the virus, for sure. But I'm assuming that this question is about drinking alcohol.
Okay.
Drinking alcohol will make you more susceptible to the virus because alcohol in general will reduce the strength of your immune system. So, it's everything in moderation, I think, during this time.
Gotcha. Do you have to have both nostrils swabbed when you're tested? So we talked about this earlier.
Right.
We'll clarify it one more time.
Yep. Right now, there's changes. Again, these things change just about every other day.
Right.
But now we're moving to a one nostril if you're having the swab that goes straight back. And we have some new tests that we're investigating where we may go to not inserting the swab as deeply, but if we do that, we're going to have to do both nostrils for those.
So the trade-off in going deep is getting both nostrils.
Yeah, you really just want to get a good sample.
Good.
You want to get some of that virus.
Gotcha. So I can't just come in and sneeze on a...
Not at this time.
I
Although
can't just blow something out on it?
that might work.
Bring a used tissue sample into you?
Yeah.
If I volunteer to get tested to do my part for the good of the community, do I have to self-quarantine after after being while I'm waiting for my results. So do I have to self-quarantine after I get the test done?
So not necessarily. I mean, we know that there are some people who are coming to the drive-through because we've said, hey, we want to know if the virus is out there. So if you're feeling perfectly fine, you have not been in contact with someone who has been sick, then I think it's okay for you to just take the precautions.
Right.
Try to stay home, wear a mask if you go out, wash your hands. I think we should all be doing that all the time, but you don't have to go under a strict quarantine order while you're waiting for the test results to come back. And we are getting those test results back quicker now. In general, it's about 2 to 3 days, depending on what day you got them. There's a longer turnaround time if you get tested on a Friday, just because of the weekend. But we're getting them back a lot quicker.
Oh, good. Okay, what do we do if we wear a mask in public? Do we wash it when we get home? Yeah, I was going to ask about this one after I get done today. What do I do with this thing? Yeah,
so the recommendations are to wash the masks periodically, depending on how much you're wearing them.
Okay.
And, again, it's just, washing machine is fine. I think they do recommend hot water, or as hot as it won't damage the fabric.
Right.
So, yeah, we do recommend that you wash them. And again, if you're just wearing it for a very short time and you're not, around a lot of people, I don't know that you need to wash it every day, but if you feel like it's been exposed, it's a good idea to wash it.
Good deal. If you go to a hotspot area, I've heard you had to quarantine for 14 days when you return. Is that true?
Well, to a certain extent, and I think it depends on where you go. So if you go to an area like New York City where there is a lot of transmission, we would it'd be a good idea for you to just stay home for 14 days.
Okay.
But, if you're taking all those precautions, if you're wearing a mask, if you're staying away from people, you're washing your hands, then I think you just need to keep doing that when you get back home.
Gotcha. Okay. All right, presumptive positive, something that's kind of been a hot topic lately. Let's talk a little bit about that. If you're presumptive positive, are you retested?
So we're working on this very diligently, and what we found is that some of the health departments are recommending retesting for that. Others did not. I actually had a conversation with the chief infectious disease specialist at Quest, and what he agreed with our approach, and that's we can retest, but we still are probably going to want to do an antibody test as soon as that's available.
Gotcha.
And just as a reminder, the antibody test is going to tell us if you have been exposed to the virus.
Gotcha.
It's possible that if I swabbed you today and then we waited 3 days and the result came back presumptive positive, if I re-swab you, I don't know if you never had the virus or if your body just cleared the virus. So it's always safer to just assume if you get a presumptive positive that it was positive, take those precautions. And I know it's very difficult, especially for people that are taking care of, family members, but it's the safest thing to do right now.
Gotcha. Do you happen to know how long the antibodies would stay in a system after you've cleared the virus? Is this kind of still being researched?
Yeah, it's still being researched. We don't know that yet. What we do think, based on our experience with other viruses, that it takes about 10 to 14 days for your body to develop antibodies once you've been infected.
Gotcha.
So similar to that other question, if I'm exposed today, should I get swabbed? If I'm exposed today, should I get an antibody test? No. It's going to take at least a couple of weeks. And everything is coming down the pike here so fast. We're still trying to figure out what that means.
Right.
Like, we don't know if the antibodies in your system really give you immunity. We think it does, but this is a new virus. We're learning as we go.
Gotcha. Is the drive-through testing open on the weekends?
Unfortunately, it is not.
Okay.
We're using a lot of staff to man this, and they're doing a great job. I mean, they are really have got this down to a science. It's really, they can get people through really quickly. But at this time, we don't have it open on the weekends. If we felt like a lot of people were calling up and saying, I want to get tested, but the only time I can do it on the weekends, we'll take a look at that and see what we can do.
Yeah, I guess the climate could change that.
Yeah, I'm assuming a lot of people are home and it's okay for them to come in on a weekday. Yeah.
Correct. How do I get tested on the weekend?
Well, again, call the hotline, and then we'll see what we can do for you.
Yeah, because I'm sure somebody could show a symptom and just panic on a Saturday or Friday night or a Saturday morning, and they may want to know something a little more than wait 2 or 3 days.
Yeah, and it's important to know that there still is no treatment for this.
So even if you show something, there's nothing you can do.
So if you are in distress, we're going to want you to call ahead, come to the ER, let them know that that's what you're worried about, so we can take precautions to protect the staff.
Right.
And then we can get the testing done there. But it's really better for everybody if you're not feeling terribly bad, if you just wait and use the drive-through.
And come on a Monday.
It doesn't expose as much of our staff to the virus.
Correct. Okay. Does the whole household have to quarantine for 14 days if someone from the household was tested?
So again, I think it depends on why you were tested. In general, no.
Okay.
I think everybody should be doing all the things that we've said over and over again. Everybody should be social distancing, washing their hands, wearing a mask. But if you're being tested and you're not feeling sick, I don't think your household needs to quarantine.
Okay.
If you're feeling really sick, then it might be a good idea for at least to keep, the members of your household. You can self-isolate yourself, but keep them from wandering around too much. Now, if your test comes back positive, then we are going to test everybody in your household. And at that point, we'd ask them to stay home.
Okay. I take care of my mom, and I have to leave the house occasionally to run errands. Should I be tested?
I think it's okay if you want to be tested, but it's not necessary if you're taking all these other precautions that we've been talking about. And again, if we can test you today and then you can go back to Walmart, I don't know that anybody wants to be tested every 2 or 3 days.
Right.
I think the one thing that's important to know is the masks are a good idea. They protect other people, but the mask doesn't take the place of social distancing.
Right.
Even if you're wearing a mask, you should still be trying to keep that 6-foot barrier because these are not medical grade masks.
Right.
So stuff can get in the sides, a little bit can get out the front. It's definitely a good thing to do, but you still want to stay away from people. And I've noticed that a lot of the stores have those marks on the floor.
Yeah.
Where you can stand back at least 6 feet while you're waiting to check out. I think that's a really good idea.
It's a good thing. It's a cultural trait. It's kind of a good one at this point that we, us Cherokee folk, we don't like to look at you and talk at you anyway. We can kind of look away when we're talking to you.
Yeah.
So maybe that's a good thing.
Yeah. Shoot the virus out that way.
Shoot out another direction. Why are we testing only one person per household?
So again, we wanted to cast a wide net. This gives us the opportunity to test a larger area on the boundary and in some of the satellite communities. So one person per household, we'll hit a lot more households with the number of tests we have.
Gotcha.
We do not yet have an unlimited number of tests.
Okay.
And if one person in the household tests positive, we're going to be there. We're going to go and test everybody then.
Gotcha. I keep seeing all these negative results from the testing sites. It seems pretty safe here, so why should I bother getting tested?
Well, again, right now we're trying to catch the virus before it gets a foothold here.
Okay.
So it's been really reassuring that we've been getting a lot of negative tests, but it doesn't take more than 1 or 2 to get in here, and things can get really out of control. So at this point, I think, if you are willing to be tested, we're still going to do that, and then we're going to reassess how many tests we have. We may pull back a little bit next week, but I think all the things that have been done here have been pretty effective so far.
Good. And why do we have to wear a mask in public? That's our final question.
Yeah, so, once again, the recommendations changed to say, let's start wearing masks when we go out, especially to the grocery store and places like that. It's important to wear the mask so you protect other people. Okay. So if I were to cough or sneeze, the mask would catch most of that, and it wouldn't be out here in the air where you might breathe it in, or be sort of hanging there for somebody to come and walk by and breathe it in. One of the other things that I forgot to mention about the grocery stores is you've seen the sort of one-way aisles that they've been putting in. And I think that's a great idea. That way, because if I'm coming and you're coming towards me and I'm coming towards you and you cough or sneeze, it's coming right at me.
Right.
If we all follow those lines through the grocery store, we've at least got that distance,
that barrier,
and there's less chance that we're gonna be exposed to the virus. So the masks protect other people. That's the most important thing.
Gotcha.
So you're not doing it as much for yourself as you're doing it for the guy next to you.
Gotcha. All right. Well, great. Do we have any other points that we want to add on to before we come off the air here?
No, I think we've covered it. I think we've gotten a lot of really good questions. I appreciate, everybody. I hope people find this useful. I'm willing to do it for as long as people, are finding that it's helping them.
Right.
And I think I'm really appreciate that you're doing this, Chris, because, honestly, this stuff can change. I can come back here 2 days from now.
Right.
And, the advice changes. So I really think it's important that the community be kept up to date on what's going on out there.
Well, yeah, I'm happy we have this resource that we can give to the public. We've still got to get connectivity out to all the little branches on the boundary here so that everybody can see this and participate in it. It's so important. But, yeah, this is a great service, and I'll be here anytime you guys need us at the hospital or public health. Shashi, did you have any questions for us that came in while we were talking?
There's an update on antibody testing. If we do anything with that.
Oh, the antibody testing? So, yeah, thank you, Shashi. So, yeah, the question is there an update on antibody testing? We know that antibody testing is now available through one of the bigger labs,
Okay.
one of the ones that we use called Quest. Last I heard, it's going to take them a couple more days to just get all the processes in place. And we also believe that we were informed that we'd have antibody testing through Harris Regional sometime this week. So I would say that the antibody testing is probably going to be available by next week at the latest. And we intend to reach out particularly to those people who are the presumptive positives and
start to do the
and
antibody
test them if they're willing to let us. That's going to be a blood test.
I was going to say, what kind of test is that? That's not a swab, is it?
No, it's back to a needle, which
Okay.
now maybe people don't feel that's so bad.
Yeah, maybe I'll just go back to the swab now. It's not so bad now.
Yeah.
Okay, great. Well, thank you so much for reaching out to us and posting your questions. The phone number, let's get the phone number up one more time before we go off the air. But yeah, thank you to the public for being involved with this, for participating. I know that it means a lot to us, and hopefully it's helpful to you guys to hear some of these question and answer sessions. 828-497-3743. Trying to read that backward. That's harder than
That's
it looks.
nice.
So, but yeah, we'll be back here for sure next Wednesday. If anything else comes up in between, and we need to get on here and talk, just come back on, and we'll update the public every time we have something new.
Yeah. Thank you, Chris.
Thank you for watching at home. Again, we hope this benefits you and that you can participate with us. Post on the Facebook any questions that you may have. Follow up from here, and we'll be back on Wednesday at 12 next week. Shki, Data Dagahanyu.